Hi, I'm Dr. Ivan Puah, and I founded Amaris B clinic in 2004. I'm an accredited liposuction doctor and medical aesthetics doctor based in Singapore. Today, we are going to talk about weight gain, weight loss, and its complications and side effects. Let's start with weight gain. How does it happen? Weight gain happens when there's a positive calorie accumulation, either due to dietary changes or reduction in activities output. So when you have any positive accumulation of energy, such as excess intake of food, calories, with a reduction in exercise and activities, as a result, causing your body to have any positive balance, then the positive balance and energy will be converted into energy that can be stored in the body as weight gain. Of course, it depends on your genetics and depends on your age and so on and so forth. But nevertheless, any positive balance of energy over a period of time will likely lead to weight gain. So how does weight gain affect different individuals? First of all, the DNA or the genetic makeups of the individual will affect the risk and extent of weight gain. For example, for someone who has a family history of genetic risk of obesity, will tend to have higher risk of tendency of gaining weight over years compared to somebody who doesn't have that. Well, secondly, age of person does affect weight gain. As you age, the risk or tendency of weight gain increases. You may find that as you get older, you tend to need to do more in order to remain the same. If you don't exercise more, if you're not careful with your diet, you tend to gain weight over years as you age. Other factors such as your hormonal levels during pregnancies, menopause, any kind of medical conditions that affects your metabolic rates does affect weight gain as well. Stress, medication, lifestyle, all these does contribute to the risk of weight gain too. So these are conditions that sometimes must be taken into account and it can be corrected with treatments and medication depending on whether or not patients suffer from any disorders. Okay, now let's talk about weight loss. Weight loss, well, can be explained in reverse of weight gain, which is a deficit in calorie or energy balance, either due to dietary management or increase in energy output with exercise or physical activities. So many things that would affect it. From dietary point of view, any reduction in total calorie intake or in choices of types of calories that you take, for example, a reduction in carbohydrates, a reduction in fat intake, a reduction in total calorie management. All these can be planned and managed well to achieve a negative calorie equation, which will lead to weight loss. And of course, there are various factors can affect your response to that, depending on your genes, your physical attributes, your lifestyle, so on and so forth. Physical activities tends to make weight loss efforts easier. However, dietary management, it's still more important in helping one to achieve weight loss. Without proper dietary management, physical exertion, exercise alone will be very difficult or not easy to help one to achieve weight loss. However, if you have a proper dietary management, increased physical activities or exercise does enhance the efficacy or ease of you losing weight. The type of activities that you do may also affect how you gain or lose weight. Aerobic activities tends to help one lose weight more easily compared to things such as weightlifting, muscle building activities. As one loses weight, if you are losing weight with dietary management or just aerobic activities, then chances are you will lose both fat and muscle mass at the same time. So the result of this is that your metabolic rate will drop at the same time. One thing about weight gain, which is often overlooked, is that weight gain is often viewed as lacking discipline and willpower to eat less and exercise more. But in reality, it's more than that. A lot of medical doctors and professionals view weight gain or obesity as a chronic inflammatory condition. Weight gain that leads to obesity is often a chronic relapsing disorder due to multiple factors that includes genetics, behavioral, psychological, environmental, medical, and others. So it's not easy to treat weight gain as just behavioral problems, but as a chronic medical condition. One interesting about weight loss is that our body appears to have a set point for body weight. Any deviation triggers a compensatory response in opposite direction to restore the set point. For example, in weight loss, energy expenditure is reduced according to resist further weight loss. And hence, you will find that the more you lose weight, the more difficult it is to lose furthermore. And weight gain after weight loss may be a physiological response rather than a failure of conscious effort. For some people, the resistance to weight loss can persist for years in face of weight gain, and this unfortunately predisposes them to excessive weight gain in future. As one gains weight, one will gain fats in either the subcutaneous layer or the visceral layer. Subcutaneous fat are what we call pinchable fat that you can feel and pinch under your skin on places like the arms, hips, waist, buttocks, so on and so forth. Whereas the visceral fats are concealed in your core, such as your abdominal fats, your muscle fat, the skin fat, so on and so forth. These are the fats which medically it's harmful for your health. So under the influence of sex hormone production, males store more visceral fats while women store more subcutaneous fats. As I mentioned earlier on, obesity can be considered as a chronic inflammatory condition. Overweight obesity can lead to higher risk in cardiovascular issues, metabolic issues, so on and so forth that will affect our long-term health. By losing weight, one can actually has lesser risk from this condition. Well, let's talk about dietary management for weight loss. And there are a lot of myths about fat diets. In summary, dietary management for weight loss, it's meant to reduce or restrict your total calorie intakes. It controls the amount and the types of calorie that you ingest in. So if dietary plan actually properly includes and plan for these few factors, it will work. So many fat diets, such as intermittent fasting, keto diets, fat-only diets, it does work. The only issue is that whether or not you can adhere strictly to the diet and how long can you actually endure with the diet and how your body responds to it. That matters at the end. But of course, there are pros and cons of each regime. You have to really look into the good and bad part of the dietary plans and be aware of it and make sure that you don't overdo them or doing it for an extensive period of time where you deprive your body of certain nutrition. And now let's talk about myths surrounding weight loss. All calories are equal. Oh, they are not. Fat has double the amount of calories compared to protein and carbohydrates, and protein are more difficult to be digested compared to carbohydrates, and hence they are not so fattening in that way. So yeah, they are not equal. Carbs or carbohydrate are fattening. Well, carbohydrates can be converted very easily to glucose and hence can be stored very easily if you don't utilize it or your body did not make use of the energy. Carbohydrates are bad. Well, it depends on whether you are taking them in excess or not. So if you are taking them in excess, yes, they are bad. Skipping breakfast, well, it depends as well. Some people, they usually take 1 or 2 meals a day, skipping breakfast or lunch. It depends on their schedule and their lifestyle. While others may have stomach issues, gastric issues if you don't take breakfast. But in general, most doctors will, or most dietitians will advise you to take a full breakfast to recharge and energize your body before the start of the day. In general, I wouldn't advise you to skip breakfast. Certain food help you burn fat. Yes, certain food help you burn more fat. Like I mentioned earlier on, protein does require your body to utilize more energy to extract the calories from it and hence help you burn more fat compared to if you ingest carbohydrates, which require less energy to be digested and hence allowing your body to absorb more calorie or energy from carbohydrates compared to protein. Eat less and move more, definitely. It's always an equation about energy input versus output. So you eat less and move more, you lose weight. What fat makes you fat? Oh, fat makes you fat. Well, that's not true. There are some fat diets that actually advise you taking a lot of fats. Under certain dietary plans, such as keto diets, actually encourage you to take more fat as energy source and hence allowing you to lose weight if you manage them properly. Healthier foods are more expensive. In certain ways, it can be if you go for organic foods and so on and so forth, they are more expensive. If you go a simple thing like vegetables, and nuts and so on and so forth, it may not be very expensive compared to, let's say, fatty meals or filled with carbohydrates, so on and so forth. Drinking water helps you lose weight. Not really. Drinking water may make you feel fuller, hence less appetite to eat more food. But by drinking water itself, it really doesn't help you very much in losing weight. High protein diets are best. Well, high protein diets are one of those diet plans that many people use to lose weight. I wouldn't say it's best, but for some individuals, it does help them lose weight. Go gluten-free to lose weight. No, I wouldn't say that that's one of the best way to do it. But if you are allergic to gluten or for some reasons because of preferences, then yes, you can use that. Weight loss is always linear. Weight loss is difficult to be, the rate of weight loss is difficult to be maintained. Like I mentioned, your body will have a set point, resist against it once you start to lose weight. So you find that the more you lose weight, the more your body resists and harder you lose weight. So it will never be linear. Thank you for listening. If you have any questions, just email us. See you again.